Good morning, Professor Papier Bernstein and classmates. My name is Cintia Riveros, and today I'm going to be presenting chapter number 6, Balance and Harmony. However, my main focus is going to be on section 6.4, which talks about the clinical interactions or the how of the therapy. This section of the book explains how do we create meaningful relationships with our clients, and how are these relationships being perceived by our client and their caregivers. Building a positive environment within our therapy session, it's an important factor of the therapeutic process, because this will help us determine the motivation, the commitment, and the enjoyment of our client within the therapeutic session. And while making it positive, we are leading us towards positive outcomes as well. Therefore, the book presents some recommendations for clinicians to take into account while working towards positive interactions with the clients. One of them talks about the balance, and the book refers to it as the therapeutic equator of supportive help. This explains, it refers to how much we are providing, how much support we provide to our client, and how do this support leads them to become independent rather than relying on our help. So this is an important aspect, because as an ultimate goal within any therapy and within any treatment, should be leading the client to become independent, leading the client to be able to perform these activities and these tasks not only during the therapy session, because as we might know, therapy are just for 50 minutes, sometimes to an hour, and sometimes this is not enough time for the client to show improvements. So the more independent we help them to become, the better the outcomes. And this takes me back to one of recommendations of Professor Papier in one of our class sessions, at which she mentioned that clinicians should be limiting the prompts and cues provided during the therapy sessions, because sometimes these are not necessary, and sometimes these are just letting the patient to become reliable on us, which is not so much of a help for them, because we want them to be independent. Another aspect taught in the book, it's about balancing our talk. When we interacting with our patients, we have to be mindful that we don't want to be seen as too caring or too controlling. Therefore, balancing our tone and our attitude while talking to them, while interacting to them, is very important, because we want to send the right message. We don't want to seem that we're talking down to them. And one of the examples of talking down provided in the book refers to the baby talk, when we use too many diminutive or cute phrases while talking to adults, because we don't want to be seen as baby them or talking them down. Another example goes to the overly personal talk, in which the interaction moves towards referring to unnecessary comments about the client's clothing, or pricing them for every little achievement, which is unnecessary, and it takes time from the therapy session. The directive talk, it's the one that seems to be very controlling or bossy, as many children can perceive the teachers when they are constantly telling them, or the therapist telling them exactly what to do without leading them to become willing to cooperate, right? There has to be a sense of negotiation within the therapist and the clinician and the client, because that way you're giving them power and a say within the therapy. We don't want to sound that we're just demanding and not leading them to cooperate. And the last one is the superficial talk, which is the trying to make up our empathy towards our client or whatever they are saying to us. So we don't want to sound fake, or we don't want to sound that we are just pretending to be there and at the moment. And it's very important that we connect our emotions to our attitudes while talking to them, so that way we don't sound fake or superficial. This takes me to another aspect about how talking to our patients, which is the jargon. It is well known that speech language pathologies knowledge is based on a combination of different disciplines. Most of SLPs have extensive knowledge or basic knowledge about medicine, psychology, education, linguistics, social work, counseling, therapy, physical therapy, and nursing. So their vocabulary, their lexical is very broad and extensive. However, when they interact with the patients, they have to be mindful that in order for them not to be wasting time on clarifying some of the terms or some of the terminologies that are too scientific or too complex, they must balance their way they're explaining things, the way they're explaining new treatment or new findings on a research, so the client doesn't feel that you are either underestimating or overestimating their capacities. And this is very important because in order for us to create this meaningful and positive relationship with the client, we have to be mindful of many aspects, such as their age, such as their mood or their diagnosis, in order for the clinician to build this strong and trustful relationship with the client. Another aspect that I found very, very helpful is taking the child's voice. This refers to how much the clinician can take into consideration the children's preferences and their willingness to engage and cooperate with the therapy session. Children are very hard to treat on the fact that some of them sometimes don't understand that therapists are working with them with a specific goal or a specific activity for a meaning or for a purpose. So in order to build that trust with the clinician has to be leading the child to become very willing and very motivated and excited to work towards that ultimate goal. And in order for them to do that, it's very important to take into consideration the children's preferences, the children's likes, what they do at home, or what they do like to play with, so the clinician can implement this within the therapy session. And by doing this, children are more willing to play and interact. And I will refer to this quote that I found very useful. Child's play is an innate driver for self-regulation, social, emotional, and cognitive development. No wonder in most of my observations, I've been seeing that clinicians are implementing games, and throughout these games, they found meaningful interactions with the child, from which they can assess and evaluate their progress too. This is very important because working with children is not an easy task, and having this awareness of how we can work with them, it would help us in our future professional development. Becoming very trusting with the children, it will lead us to help them achieve more and gain more out of the therapy session. With this, I'm going to be concluding my presentation. I hope you find this helpful, and I wish you all the best. Thank you for watching my video.